Good morning. Today is Saturday, March 16, 2024. Today is our scheduled yoga therapy class. Okay, let me do a little sound check. Check, check, check. Sound check. Okay, here we are. Okay, here we are. Okay. Sound check is perfect. Okay, so today's program. Again, as I said, we have been doing program for all the requests. So today's request is from a physician friend, a doctor friend from Florida. He's a retired gastroenterologist. He's suffering from fibromyalgia and have all the known therapies what we had by now, and he has requested me for a yoga therapy for fibromyalgia. So as usual, first let's find it out what is fibromyalgia, what is the underlying cause, and what the yoga therapy can provide for fibromyalgia. Fibromyalgia is a group of disease which is basically recently known. I think it was diagnosed around mid-80s, and it is a group of disease which are called the functional disorders. Functional disorders means this is in the same group of disease like a irritable bowel syndrome, like a chronic fatigue syndrome, chronic pelvic pain, interstitial cystitis, overactive bladder. But the same group of disease, what we believe from yoga therapy perspective, these are called your dysautonomia. Dysautonomia means a disorder of the balance of the autonomic nervous system. We have two sympathetic system, sympathetic tone, which we call fight and flight response, which we need for our day-to-day survival also, and the stress increases the sympathetic tone and also the production of cortisol. Parasympathetic tone, on the other hand, is a calm and digest. It is the opposite of sympathetic tone. And the balance between the two we need for maintaining proper homeostasis. In fibromyalgia, two things happens. The first, it is a dysautonomia, that means autonomic functions are not functioning well, and it also a hypersensitivity of the brain to a pain receptors or pain stimulus. What it means, for a normal person, what is not going to cause pain causes pain in fibromyalgia. Example being, there are points. There are X number of points which actually the pain physician or orthopedic physician or rheumatologist makes a diagnosis, they go into the point and then a little pressure, a little touch will excite the pain, which is not in regular person. Also, the diagnosis is done primarily by the rheumatologist after excluding osteoarthritis, rheumatoid arthritis, or autoimmune disorders, and coming to the point of a fibromyalgia. So what are the practices we can do? First, it is a hypersensitive brain, or you call a hypersensitive mind. Remember, mind is the container and the brain is the content. Mind is the content of your five senses. I hear, I see, I smell, I taste and touch. If you put all the information in a container, that's your mind. A hypersensitive mind, and what we call a mind is a software, body is a hardware. That means our software is not functioning well. So it is basically a bug in the software, and the therapy primarily is based on your, we call it a software updates. Like you get in this our cell phone, the software updates, and you will be doing. So first, in a fibromyalgia, it is a unusual pain, and also it is more prevalent in women. From a yogic perspective, what we have seen, the most powerful tool for fibromyalgia is the balancing practice. Balancing asanas, balancing pranayamas, and a deep meditation. Also, a restorative yoga asanas. Restorative yoga asanas, like you can put your feet up against the wall, called your Viparit Karani Mudra. I'll show it to you. Or laying in the bed, the way the baby sleeps. If you look at all my sleep presentation, you will see it is called Supto Baddha Konasana. It is the laying down closed angle pose. You can be supportive, non-supportive. A powerful restorative pose is your Savasana, corpse pose. But remember, any asana where you are comfortable doing, so simply sitting in a chair and just doing a little spinal twist, staying in the pose with the effortless breathing and no pain, exhalation longer than inhalation, and staying there for minutes and minutes and minutes will take you to a restorative yoga. So any long-lasting asanas, because asanas have 3 stages. Arambha, at the beginning, when the muscle contracts. The muscle contracts, you will be doing the asana pose. Here my muscle is contracting. Let me get into this spinal twist. If I stay here without any pain and effortless breathing, the muscle will start to relax. Before relax, it will do a little bit of twitching. This is called fasciculation. That's what you see called a sthiti. Sthiti means stability. The muscles are all stable now. And finally, it's called your visarjan, is a profound relaxation. So, one of the underlying cause of the fibromyalgia is a tightness of the muscle and all the pain fibers are all in the muscles and the ligaments, and the pain fiber gets activated, disproportionately than the other people. So relaxation of the muscles, relaxation of the ligaments is also a therapy for fibromyalgia. First, we are called unilateral. That means I'm right-handed, right-footed, I'm using right hand, right foot, left side of the brain, I'm not using right side of the brain. First yoga practice is bring the balance back. So we all use, like for our practice, we do is try to use your left hand as much as possible. We brush with the left hand, we use our left hand, anything you want to do with the left hand, because right hand has been doing it for a long, long time. So between the two balance of the brain, you can do a little bit of a test. This test is through your eyes. Why? See, when you're walking, your feet are grounded. The feet are like, suppose a body is like a car, your feet is like a tire. So tire should have a proper equal pressure and both front and the back for you to propel. And the steering wheel for the car is your eyes. The eyes is the steering wheel. So let me show you what we do. You will practice it first. You have your left index finger. Keep looking at your left index finger and bring it as close to your nose. If your brain is in balance, both the eyes should be in the equal position or equal separation from the tip of the nose. So let me show you what we have done, a little interesting technique. You take a selfie. You take a selfie with your camera. You take a selfie with your camera and then try to see and take a picture of your eyes. Then you can analyze those pictures to see the imbalance between your two sides of the brain. So here you are. You are bringing it close to your nose, looking at the tip of your nose with both the, looking at the tip of the nose with both the eyes equally, and you took a picture. Now you go back and take a look at this picture. Okay, I don't see the, I don't see the pupil, the eyes as well. So let me see if I can do it again. One more time. Bringing it back close to your nose. Look high up. You may not appreciate this much, but if you if I can see it, if you can look at the pupil, both the pupil are almost an equal distance from the tip of my nose. So I would say I'm a little bit of a properly balanced, and you can test it yourself. So to bring this balance back, one of the powerful tool is your called tratak. You can do a tratak. Tratak is the movement of the eyes, because remember, eyes are your steering wheel. Eyes are going to bring the balance back in your body before you start practicing any balancing poses. So your hands are on both sides. You can put your thumb high up. So these are the practices you will do for fibromyalgia. First, look to the left, look to the right. Look to the left, look to the right. Look high up, look down. Look high up, look down. Look upper right, look lower left. Look upper right, look lower left. Look upper left, look lower right. Look upper left, lower right. Finally, you can do the rotation of your eyes, and with a very relaxed, call it a adhimudra. Look up, look to the left, look down, look to the right. Up, left, down, right. Up, left, down, right. Up, left, down, right. Opposite side, up, right, down, left. Up, right, down, left. Up, right, down, left. So do a practice of tratak. Another one is called a jyoti tratak. Like you put a flame in front of you. You put a electronic candle, or you can put a regular a flame or candle or a diya, and look at it until you start having some, it's almost as a watering in your eyes. Before the restorative practices, let me show the restorative practices. Let me show you that what is most important in fibromyalgia is your balancing asanas. So most important balancing asanas will be for your see the able to activate in the opposite side of your brain. So what is the number one balancing pose will be? I'm comfortable standing like this with my feet along the line of my shoulder. So as I bring the balance back, I'll put my foot together. This will slowly bring back my balances. I'm right-handed, right-footed. Let me see if I can stand on my left foot. Initially, you may have to put your hand on a chair and then let it go. 5 seconds, 10 seconds, 15 seconds, 20 seconds, 30 seconds, 40 seconds. If you can come up to the 40 seconds without holding anything, your next will be able to do an impossible task initially, which will be closing your eyes. Close your eyes and stay in the balancing pose. Initially it becomes almost impossible, but with the practice you'll be able to do. Close your eyes and see if you can stay in the posture. Close your eyes. A wonderful tool, closing your eyes and able to stay in a balance. Practice the same one with your, now is your dominant foot, right foot. Again, you can touch it, practice it. 5 seconds, 10 seconds, 20 seconds, 40 seconds. Longer and longer you do, you close your eyes and see if you can stay in this posture. You become it's very difficult initially, but it will come to you. Close your eyes, able to stay in one pose, one leg. It is almost sign of a good health, because when you do the balancing, you have a concentration of your mind, and all the hyperactivity of your mind, it goes away. Okay? Close your eyes. I'm on the left, standing on my left foot, closing my eyes. I'm holding on my chair a little bit, but slowly I will let it go. Another way to do it is to bring the relaxation response with a Paschim Namaskar. Put your hands to the back. And slowly put your hand in a Namaskar Mudra. Just 1 second. Paschim Namaskar causes relaxation. Yoga practice is holistic. So it does not only relaxes your upper part of the chest, it relaxes your whole body. And able to stay in this asana with no pain and effortless breathing. Now my eyes are closed with my hands in a prayer pose. Let me see if I can stand on my left foot. It also becomes very difficult for me now. I practice it almost every single day. You are coming to an age group where you start losing your balance. This practice is a must for fibromyalgia. Same way. Close your eyes. Now you are on your prayer pose to the back, Paschim Namaskar. Eyes are closed. You're standing on your one foot. One of the relaxation practice is your Kapalbhati Pranayama. Kapalbhati Pranayama So we do not want to practice pranayama standing up because pranayama causes altered sense of consciousness. So you can do a Kapalbhati pranayama just to be sure you are relaxed, like this. So now you can do a brikasana, a tree pose. And with a tree pose, you can incorporate Kapalbhati pranayama. So it's a balancing and relaxation. Same way that in a day-to-day practice, you incorporate your relaxation response. Say, for example, you can, whenever you are sitting in a chair, okay, you're sitting in a chair, you incorporate your Gururasana, like your eagle pose. Take your one foot in the back, turn it around, and wrap it around your leg. Let's see a little bit better. Take one foot and gradually you'll come here and be wrapping it around. And you stay in this posture when you're performing other duties. Like in this position, you can, when in front of a computer, you can do your computer, or you're having a dinner, you can have a dinner, or read a newspaper, sitting like this. And always also balance on the other side. This is a wonderful relaxation, right? In fact, this is a wonderful for your also knee problem, osteoarthritis problem. And a lot of fibromyalgias we have seen that are associated with osteoarthritis, associated with hip, knee joint pain, and also associated with your autoimmune disease, some autoimmune disease, or sometimes collagen vascular disease, rheumatoid arthritis. So, a restorative pose. Powerful restorative pose is going to be your, okay, we call it a relaxation restorative pose. You know, able to sit down in a squatting pose, you call it malasana. It's a relaxation response. Listen, in this position, your ankle is relaxed, knee is relaxed, hip is relaxed, back is relaxed. When you put your hands, separate your fingers, hand is relaxed, wrist is relaxed. You put your elbows on both sides, it's a relaxation response. You are able to do this, muscle cramps will be gone, pain of the muscles will be gone. There will be no pain fiber which will be activated by the contraction of your muscles, because this is your an antidote to your fibromyalgia. You can slowly get your foot high up. Viparit Karuni Mudra. In a restorative asana, you stay in the asana. A long period of time. Long period of talking, maybe over 5 minutes in an asana. Remember, when the muscle contracts, muscle is contracting to let me get up into this pose. Muscle cannot stay contracted that long. Muscle is going to relax. Before its relaxation, it causes some fasciculation. Finally brings a profound relaxation, which is called Visarjan. Viparit Karani Mudra. Supta Baddha Konasana. The way we sleep and actually the way the baby sleeps. Show it to you. First, you lie down, then you do a closed angle pose. So you're getting down first. Be sure the chin is little below. If head is a little too high up, you can always put a little bit of a pillow and support. To fit together, and remember, if you look at a baby, that's the way the baby sleeps. Supta Baddha Konasana. Hands on both sides, palm facing high up, and all the fingers touching the ground. Be sure there is no pain. Be sure your breath is effortless. If you have a little discomfort, You can put a little bit of a pillow underneath both of your knees. But remember, this is called a comfortable discomfort. Restorative asana, and this is the way we also start our sleep. Because the best person who sleeps well is your babies and the yogis. And also people with fibromyalgia has a sleep disorder. Large number has a sleep apnea and also insomnia. Slowly you can turn on one side. So I'm showing you for the purpose of demonstrating, but in your daily practice, you do it as long as you can. Child pose, when you're going to call it balasana, in fact, what you will do, you take a little pillow, and a wonderful relaxation and a balancing asana is your Gomukhasana, cow face. And if you've been following me in my practice, you'll always see if I sit down with a cross-legged like this, this is called your Sukhasana. In a short time, I'll change the foot, I'll sit down again to activate both sides of the brain, bring the balance back. First, you get into a Vaisasana. Vaisasana basically is called a buffalo pose. You get one foot on the top of the other. This is a very relaxing asana, and this relaxation gets imprinted in your mind. Can get your left knee is up, left hand high up, put right hand to the back, put the right hand in the middle. Hands together, and slowly it will be like a handshaking each other. Let me show you from the back, so you will see why it is a balancing and and relaxing. Able to sit in this posture like you're sitting like a buffalo or a cow, relaxing the whole body. Left hand going high up, the right hand is coming up. I try to put it in the middle. Left hand comes down, it touches, clicks, and slowly you'll be able to handshake each other. To bring the balance back, you switch over your leg. Now, the right knee is in the top of your left knee. So if you wait a little bit, relaxation sets in, right knee is in the top, right hand goes high up, left hand is in the bottom, left hand goes into the middle, and comes down, you hook it, you literally handshake the two hands. Have you noticed you have been done this equally on both sides? Whenever imbalance, you'll see you'll be able to do one side better than the other side. When you do both sides equally, it is it. Restorative asanas, balancing asanas. Able to get down to the ground, and from the ground able to get up without a support. If you can get up without a support, it is another way of telling you that you've achieved a profound relaxation response. The whole practice of fibromyalgia is a balancing and relaxation and able to hold in the asanas as long as possible. That's the restorative poses. For the pranayama, your regular breathing out longer than breathing in, is a good restorative pranayama. Since your mind, which is called your software, and we call it the CPU of your body, now your mind is hypersensitive to your pain sensation. All of our function of our brain, function of our mind is due to your vibration. If we do an EEG, electroencephalogram, we get a wave from your vibration. So you create another vibration, you shut down your five senses, and you will get the calming and quietening effect, and that is your Brahmi pranayama, bumblebee breathing. Index finger in the forehead, 3 fingers to close your eyes, and thumbs to close your ear. You can always also do a Shanmukhi Mudra to close it, but this is a very nice way. And then you will breathe out first, take a deep breath in, and breathe out with the sound of a bumblebee. Normal practice, we do it a little longer time, and it follows about we do 3 to 7 bumblebee breathing, follows with your palming and cupping. Rub your hands when you feel the warmth in your hand. If you're wearing glasses, remove your glasses, take the hand like a cup, put it over your cup. Let the eyes take all the heat from your hand. The heat relaxes your eyes, relaxes your ciliary muscles, reduces, increases the convexity of your lens, so it almost acts like your reading glasses. Eye is also supplied by the 4 cranial nerves. Second cranial nerve, optic, the retina, SO4, LR6, superior oblique muscle supplied by 4th cranial nerve, lateral rectus by 6th cranial nerve, the trigeminal nerves, facial nerve. So eye is supplied by the large number of facial nerves. Massage your forehead, massage your eyes, massage your face. All the muscles here are attached to your skin, be able to relax. All the skin lines goes away. Your whole face goes away. Take your hand, massage behind your earlobe, behind your ear, in front of your ear. And also you can stimulate a little bit of inside the external auditory canal. There's a branch of the vagus nerve called auricular branch of vagus nerve. Vagal activation is a parasympathetic activation and relaxation. Bring your hand, massage your carotid sinuses on both sides. Carotid sinus quiets down your cardiovascular system and the nervous system, and it also vagal activation. Bring your hands to the back, massage to the occipital tubercle. The 2 muscles, sternomastoid and trapezius, both are supplied by your cranial nerves. It's a wonderful pranayama for your fibromyalgia. And then quieting your mind is your pranabho pranayama, A, U, Ma. A comes from the lower part of the lung, Ma comes from the middle part of the lung, Ma comes from the upper part of the lung and associated with the mudra. When you touch your index finger and thumb, put your palm high up. This is called a Dhanu mudra or a Gyanu mudra. When you put your hands down, it is called a Chin mudra. Chin mudra opens up lower part of your lung. If you close your fingers, this is called a Chinmay mudra. It opens the middle part of the lung. Then if you take your thumb inside and close, this is called a Adhi mudra, called a Balamushti mudra, like the way the baby closes their fist. Chin mudra, A. Breathe out first. Ooh, the chin mudra, middle part of the lung. Breathe out first. Adhi mudra or Bala Mushti mudra, very relaxing mudra. And Ma. Remember, you always breathe through your nostril. Do not breathe through your mouth. Mouth is for eating and talking. Breathe out first. You are in a profound, balancing and relaxation. So basically chanting, which is your pranava pranayama. The alternate nostril breathing and alternate nostril breathing activate both sides of your brain. Use your left hand to use a dhanu mudra or a jnana mudra. Use the right thumb to close your right nostril. You don't have to press all the way down. Just close underneath your nostril. That's good enough. Breathe out through your left nostril first. Breathe in through your left nostril. Close your left nostril with the ring finger and little finger and breathe out through your right nostril. Breathe in through your right nostril. Close your right nostril, breathe out through your left nostril. Left nostril is controlled by your right brain. Continue the alternate nostril breathing. Right brain is intuitive, right brain is female, right brain is cooling, right brain is parasympathetic. Left nostril breathing is calming, cooling, and it's a parasympathetic activation. It is called a Chandranari, moon energy. Right nostril is controlled by the left brain. Left brain is analytical, left brain is male, left brain is hitting, left brain is sympathetic. Right nostril breathing is called your sun energy, Suranari, Pingala, Pingalanari. Alternate nostril breathing activates both sides of your brain. And also behind the left nostril is the activation of your parasympathetic receptors. And behind the right nostril is your sympathetic receptors. Slowly put your index finger and middle finger in your third eye and bring your awareness to your third eye and continue the alternate nostril breathing. Also incorporate a balancing called super brain yoga. The left hand hold your right earlobe and continue your alternate nostril breathing. Within a short time, you will be almost in a transcendental state. You will have no idea where you are. You'll have no connection with your surroundings, and slowly will enter into your subtle body. We have three bodies: gross body, sthula sharir, subtle body, Shukha Sharir, and causal body, Karana Sharir. Shukha Sharir, or your subtle body, is the body of your mind. So like a subtle body is like, I can visualize my subtle body. I'm sitting here, my mind is where I used to do the session in Portsmouth, Virginia, a place called a septic space. I can visualize, I park my car, I'm entering the door of the septic space, I'm sitting in the yoga mat, and I started teaching the class in septic space. Same way, I can touch a various part of the body with my eyes closed. I can touch the tip of my nose, I can touch my head, I can touch my left earlobe, I can touch my right earlobe, I can touch my left shoulder, right heel, left heel. So the same way I will be able to do an alternate nostril breathing without closing my nostril. Touch the index finger and thumb on both hands, Dhyana Mudra or Jnana Mudra. Close my eyes. Bring my awareness to the left nostril. Breathe out through the left nostril Breathe in through the left nostril. Breathe out through the right nostril. Breathe in through the right nostril. Breathe out through the left nostril. I can clearly see my air is coming out through the left nostril, going in through the left nostril, coming out through the right nostril and going in through the right nostril. You have a microphone, I can let you even hear. Once your eyes are closed, your spine is straight, you can do this in silence, and that is called your meditative alternate nostril breathing. Let's do it for a few minutes, and you'll see the effect of it in fibromyalgia. Slowly continue your practice. If you continue that, we have said that you will be completely relieved from fibromyalgia symptoms. Bring your hand, touch your little finger and thumb, separate your ring finger, middle finger and index finger. There's a Padma Mudra. It connects your body, mind and spirit. Slowly bring it close to your heart. Heart is the site of the soul. A practice of yoga therapy brings a relaxation response, activation of parasympathetic tone. It is a powerful tool. The restorative poses or restorative asanas, balancing asanas are the key for the therapy of fibromyalgia. Quieting down your mind with your bumblebee breathing, Bhramari Pranayam, or your Pranava Pranayam with the chanting A, U, Ma, and alternate nostril breathing with their nose closed and nose open. Slowly bring your hand in front of your heart chakra, Anahata chakra. Put your hands together, bow your head down, say Namaste. I honor the divinity within you, you are divine, and it's a wonderful practice for fibromyalgia. So let's bring more requests and I will do it. And always remember, we practice with a health tracker. We're watching all of our health parameters. And also this is an Apple Watch, so whole information is going to the iPhone. You can go to the iPhone, I can look at my heart rate, I can look at my heart rate variability, with my whole function of my sympathetic and parasympathetic tone through this health tracking device. Thank you for joining. I hope my friends will be seeing it and he will get better and cured. He has tried every medical approach, Western medical, Ayurveda, pharmaceutical, the homeopathic, I mean, he just went on and on and on. Okay, see you again. I'll see you again on Saturday when I'm here. And if I'm out of town for any kind of programs, I'll let you know beforehand. Thank you for joining. Again, please make some comments, questions. I'll be glad to answer for you.